This is my persuasive speech on medicinal marijuana. Marijuana as an intoxicant. It was the year 2003. My parents had packed my bags and I was headed west. Lincoln, Nebraska bound. I had a one-way ticket with no return in sight. I was to be admitted at the Independence Center, the closest inpatient treatment facility that insurance covered. I was addicted to many things: the parties, the bar scene, the dancing, the false sense of courage to do and say as I pleased, with what I thought were no consequences. In treatment, they ask what your drug of choice is. I would say my drug of choice is marijuana, but meth is the one that got me. I was 21 and I acted like I was 12. I was having a blast. Life was great. One of the things I used to say all the time is, I only have one life and I'm gonna live it. Not realizing what chemicals I was ingesting while being very spontaneous and reckless with my life. Thank God it came crashing down and I hit rock bottom, as they say, or I would probably be dead. I consider marijuana a gateway drug. With it being legalized throughout the U.S. for medicinal purposes, I believe it will close the gate to the world of hardcore drugs. Flash forward to the year 2015, and we have marijuana as a medicine. Today I'm going to talk to you about the benefits of medicinal marijuana and the shocking revelations that I have discovered about trans-delta-9 tetrahydrocannabinol, or THC. I strongly disagree with a person like me using THC or it being used recreationally. I truly believe that the benefits of medicinal marijuana are much less risky and safer for patients than the pharmaceuticals being prescribed for certain conditions. I graduated with my LPN license in 2011. When I finished my RN, I planned to get my Bachelor's of Science. I wanted to tell you about this guy that has ulcerative colitis. It's a chronic autoimmune disorder which causes inflammation and bleeding ulcers in the intestinal tract. Sounds painful, huh? Many times he has had to race to a gas station for the fear of bowel incontinence. How horrible for a 32-year-old man to debate having to wear adult diapers. 3 years ago, his gastroenterologist put him on his last option, Remicade. It is an immunosuppressive drug that weakens the immune system, making people vulnerable to bacterial and viral infections. It also has an effect on the liver from metabolizing the drug, and it carries a risk of lymphoma. Some of the other side effects are fatigue, fever, headache, dizziness, depression, insomnia, a general ill feeling called malaise, abdominal pain, and respiratory infections. All of the risks this man took for a whole year on Remicade, and it didn't even work. He still had the urgency and the frequency of watery stools, and the cramping was still present. Actually, I lied to y'all when I said it was his last option, but for him it was. He could have had a surgical procedure, removing his colon and pulling the end of the intestine out of the abdomen and wearing a colostomy bag. A poop bag. So I ask you a common question healthcare professionals ask. Are the benefits worth the risk of the medicine? The answer for him was no. He would rather not risk getting lymphoma or decreased liver function for a medicine that wasn't even working. And who wants to have a surgery to cut out part of your body? He still had the pain, urgency, and frequency, all of which inhibited him to live a happy and successful life. For a year, he contemplated diapers versus surgery, just to have a sense of normalcy. With all of the hype about medicinal marijuana, he looked into it. And sure enough, medicinal marijuana helps with Crohn's disease, which is very close in the pathology of ulcerative colitis. Ulcerative colitis solely infects the large intestine. So what do you really know about medicinal marijuana? How long has it been around? Does it really have as many medical benefits as some say? In an article retrieved by PubMed, it was concluded that the statement made by Dr. Hare and Dr. Christie in 1892, that's more than 100 years ago, was found to be true. Cannabis is very valuable for the release of pain, particularly nerve disturbances. It produces sleep, and it gives great relief in paralysis. It also quiets tremors. It was finally proven to be correct in the last few years. Medicinal marijuana is on the rise throughout the United States, and it is a widely talked about issue. There are medical benefits to using marijuana, including possibly treating cancer. I wonder how much more will be discovered as time goes on. The drug still poses a risk to developing adolescents, people with mental disorders, and people who already suffer from heart disease, especially when it is used as an intoxicant rather than a medicine. According to TakePart.com, oh, I moved that. In the U.S., there are 20 states that have legalized medicinal marijuana and 12 more states that are currently debating legalizing marijuana. There are 18 states that marijuana is completely illegal. This, I don't know if you guys can see it, but the yellow states is the illegal ones is the Bible Belt down in the South, and then some of the Midwest. Both the East Coast and the West Coast have medicinal marijuana, and Montana and Illinois kind of sporadically. Washington and Colorado have legalized marijuana for recreational use as well. I researched a website called cancer.gov. The cannabinoids in marijuana cause induction of cell death, inhibition of cell growth. It can stop the tumors from reproducing, and the cancer cannot metastasize. The cancer cells die without affecting the normal cells. The study was actually done on mice, and it appears that marijuana could be the cure for cancer. WebMD states that doctors are prescribing medicinal marijuana currently for muscle spasms caused by multiple sclerosis, nausea from cancer chemotherapy, poor appetite, and weight loss due to AIDS or nerve pain, seizure disorders, and Crohn's disease. All of these things are what marijuana is already being prescribed for. If it is truly capable of destructing the tumor cells, like cancer.gov stated, if it's truly destroying the cancer cells, like cancer.gov stated, it will actually destroy those cells, leaving the normal cells to live. Cancer chemotherapy drugs kill all of the cells. That's why people lose their hair, get a general ill and weak feeling, because all of the cells are being killed off when it's trying to kill the cancer. Science Direct states that marijuana is the crude drug derived from the plant Cannabis sativa L. Although all this new research seems to be amazingly true, marijuana is still a drug just like any other drug or medicine. If a person doesn't have a prescription for it, it's considered drug abuse. I abused this drug as a teenager, and it introduced me to meth, which damn near killed me. But the more and more research I do on marijuana, the more I realize how much it's helping people with seizures, particularly paralysis. I saw one girl that learned to walk. She hadn't walked in 25 years, and the seizure medication had made her pretty much in a vegetative state. She actually gives testimony that she felt like a person who was trapped in her body. The most common side effects of marijuana are dizziness, drowsiness, impaired thinking skills, problem-solving skills such as arithmetic, and short-term memory loss. These side effects generally last 1 to 4 hours. Some reporters actually report a positive feeling such as a mild euphoria and relaxation, while other particular naive users report anxiety, paranoia, and panic reactions. All of this was in a report done by California Society of Addictive Medicine. They also report, by large, the adverse reactions that marijuana has on the brain are reversed as soon as the patient discontinues the use. They also state that smokers of marijuana are at risk for acute and chronic bronchitis due to alterations of the mucosal lining and the respiratory tract. But for medicinal marijuana, it's actually the cannabinoids that they're using, and a person doesn't have to smoke the marijuana. They actually they have edible marijuana in Colorado. Marijuana has been shown to increase the heart rate and can slightly raise the blood pressure, and that's with the initial use of it. But the raising of the heart rate and the blood pressure is not associated with the disease. People who use marijuana or have pre-existing medical issues such as heart disease or mental illness are at severe adverse reactions. They also said that marijuana in sufficient doses is not medicinal doses can actually cause psychosis, a state of mind in which a person cannot differentiate the true from the false. It may also contribute to lifelong psychosis, such as schizophrenia. But another source, Dr. Lermine on WebMD, He states that he believes the relationship between the psychosis and marijuana use is actually reversed. He says, "What I suspect is people who are going to develop full-blown schizophrenia must feel bad beforehand." So he's saying that people with mental illnesses or unresolved issues tend to self-medicate, whether it be drugs, alcohol, food, shopping, or excess working. In conclusion, I would like to tell you that the man I mentioned earlier with the ulcerative colitis has not had a bloody stool in the last 2 years. He has been using marijuana. No stomach cramps, no fear of public or crowded places due to inability to get to a restroom if needed. He can pass gas without having bowel incontinence, and not once has he had to leave a gas station after racing to get there with soiled pants in hand. Last Christmas, we finally went ice skating with our 6-year-old. We have been wanting to do this since my daughter was 3 years old. I have to tell you, from a person who absolutely hates marijuana and what I thought it did to my life years ago, it has given my boyfriend of 6 years his life back. I cannot imagine what other families throughout the world are experiencing from what seems to be a miracle medicine. Top it off, it is a natural homegrown plant. Compared to the pharmaceuticals that cost way too much money and alter the chemicals in and throughout a person's body and brain, many times having lifelong side effects and complications. I am so excited to see what changes continue to be made throughout the United States. I really hope that medicinal marijuana becomes a nationwide legalization, because life would be easier. Having somebody who can benefit from medicinal marijuana, it really sucks, because as far as I'm concerned, I can't be around it, and I don't want to be even seen with it. It's illegal, and it could still destroy my life today. Oh, I need to get crunchy. I screwed up.